Asmau Muhammadu was 12 years old when she got married. At 15, she had her first pregnancy.
When it was time to go into labor, I had trouble, so they had to take me to the hospital. On the 4th day, I gave birth, and my baby wasn't alive.
Her difficult labor caused a tear between her birth canal and bladder.
I noticed the leakage after I was discharged.
Asmau, who is now 27 years old, can no longer hold her urine. Her mother has the same condition. It's called an obstetric fistula. Around 500,000 women in Nigeria develop obstetric fistulas. 22-year-old Fadimatu Abubakar has had it for 4 years. Her husband left her. Most of the women here are divorced and live as social outcasts. Dr. Bello Lawal says communities do not realize that their cultural practices of traditional surgeries are also causing women to get fistulas.
The community is also not fully aware of the causes of VVF. There are a lot of misunderstanding, misconception. We know basically VVF is caused by prolonged obstetrical labor and some traditional practices in this part of the world. Like the yankan gishiri that is done by the traditional barbers, the yankan guria that is done by the traditional barbers. This thing lead to VVF.
Ilyasu Ningi is a traditional barber. On his female patients, he performs vaginal surgeries known as gishiri in the Hausa language. These are the tools that he uses to remove what he says are obstructions in the woman's body. He says he knows that his work can cause a fistula, but that he does the best he can to prevent it. There's a backlog of nearly 200,000 women across Nigeria waiting for fistula repair surgeries, and only about a dozen doctors to handle the complex cases. Back in her village, Asmau has accepted her fate.
I didn't feel good at all, but it was destined by God to happen that way.
With more than 20,000 new cases of fistulas, health workers, activists, and government officials say Nigeria has a long way to go to reduce the burden the abnormality causes. Chika Oduah for VOA News, Sokoto, Nigeria.